Are steady hands a necessity for surgeons or people that want to become surgeons?
So this is a long debated question. Actually, steady hands are definitely a nice thing to have for sure, but you can definitely train yourself with enough hours of practice to make up for it and in a sense, train yourself into having steady hands. So if you are, sitting in a high school classroom and you're trying to balance something and watching to see if your hands shake, that shouldn't deter you from going into medical school or wanting to be a surgeon, because it's just about that 10,000 hours of practice. And the more you practice, the steadier your hands become. Of course, if you shake like a leaf because you have a familial tremor and it's never going to go away, that could be a problem for sure. And in that case, maybe surgery is not the right field for you.
It's a good thing to have, but definitely not necessary, huh?
Yeah, not necessary at all to be a doctor. And to be a surgeon, you can train yourself to have steadier hands, as long as it's not like you don't have like a medical condition that's preventing you from working on it.
So what are the biggest things that you learned once you started working, or like what did they not teach you in school?
Yeah, that's a good question, I think, for this field, for sure. I think the one thing, kind of a theme here, is you'll always be learning even once you start working in medicine. Like, you think once med school ends, you'll be a resident and you'll learn residency, and then once you're done being a resident, you'll be the boss. But even when you're the boss and you're working or you're a fellow, you still realize every day how fast medicine is evolving and science is evolving. And to keep up with the latest treatments and the latest medicines for your patients, you always have to be reading and learning. And that's something they don't really tell you. I think you picture it as you're going to graduate and be a doctor and start living your life, but you'll always be a student in some sense. And that's something that they don't really tell you when you start.
It just seems like the medical field in general, especially if you're going to go to med school, grades are actually important, because I talk to some people with some professions and sometimes they're like, either one, grades aren't that important once you get a job, or two, they don't use a lot of what they learn in school in the real world. Now, from my small understanding, is that like kind of the opposite with medical? Do you need good grades, and two, do you actually need to know the stuff you're learning for the real world?
Yeah, I know the kind of jobs you're talking about. This would be the opposite of that. There's a lot of stuff you learn early on, the very basic science stuff like chemicals and chemistry and cells and cell biology. And yeah, you may never use that stuff again. That's the real foundational science stuff. You just have to know that so you can get good grades and move on to the next step of getting into medical school. But in terms of once you're in medical school, the material you're learning, you will use that material and it will come back to haunt you in one way or another when you're actually practicing. Even as now doing hand surgery, which is very specific, I still have to think back to the mechanism of action of a drug for a diabetic patient before I do surgery on them to make sure it's okay that they continue that drug and kind of know what's going on with them in their life, their health, other than just their hand before I operate on them and, mess up their heart if their heart is fragile. So it's definitely the opposite in medical school. Everything you learn will be a tidbit later in life. You'll have to kind of pull out of your mind's deep hole.
So now after college, the next step is to take the MCATs. Do people typically take that while they're in college, like in their junior or senior years?
Yep, the standard path, I think, is the end of your third year of college, right about then. Some people take a gap year if they're not sure what they want to do coming out of college, and they, are thinking medical school, but they're not sure. They can take a year off and work in a different industry, do something else, travel the world, and then apply to medical school a little bit delayed. And so you can always take your MCAT after college. You don't have to take it during college, and you can still go to medical school.
Is the MCATs, what do they ask on that test, especially since in college you don't have to go for something medical? Do you have to study separately for the MCAT?
Yeah, so since you don't have to be, so for medical school there are some prerequisite courses you have to take, biology, biochemistry, math, you have to take chemistry and all of those kind of core classes. You don't have to be a major in it, but you do have to take the core at some point. So then that material is what appears on the MCAT. Plus, the MCAT has some areas now, changed since I took it so long ago. They have some kind of analytical reasoning, and they used to have a verbal section. I think now they have an ethics section. So they do have some stuff that you have to work out kind of on the fly.
And did you enjoy college? And the same thing goes for med school, I guess. Like, did you enjoy the college and med school experience?
Yeah, I think if you are a type of person that is self-motivated, and you really do actually just enjoy, learning and reading and kind of immersing yourself in what you're doing. You'll really enjoy, obviously you enjoy college then, but you'll really enjoy medical school because that's when you're doing what you actually are interested in and you're surrounded by people who are also interested in it. College was super fun because, you have a great time, you meet tons of people. It's a whole new experience leaving high school and having a good time on your own. In college, you probably won't have as much fun as your friends who are business majors or doing something a little less stressful. You'll miss out on all those times they go out and you're at home studying for an exam because you need to have really good grades and be competitive. But once you get to medical school, you kind of get to be with all the people that did the same thing you did in college. And it's kind of, it's nice to be around people who are in the same boat as you are. So I had a great time in college. I still went out and had a fun time, still made a ton of friends, joined a lot of clubs, went to sports games, went out to eat, all that good stuff. And in med school, we still did the same thing. But, when you're not doing that stuff, you just study pretty hard.
So do you pick your medical specialty while you're in med school?
Well, you sort of do. When you're in medical school early on, everyone learns the same curriculum, just like the nuts and bolts of medicine, kind of just a good foundation, how to be a doctor. But then in your last year or so, you have to decide what kind of doctor you want to be because you end up matching into that field through this kind of complex computer system. And it's based on your scores in medical school, your scores on standardized exams in medical school. And certain specialties need higher scores. They're very competitive. And other specialties don't need as high of scores, and there's more training spots in the United States, so they're a little bit easier to get into. It's a little bit of a complex system to end up in the field you want to end up in, depending on what your grades were in medical school and how many training spots there are for that field in the United States. Because some fields, there's very few spots, like ophthalmology, which is doing stuff for the eye, and then dermatology, of course, are very competitive because there's very few training programs. And so, if a lot of people want to do it, there's not very many spots. Whereas other fields like internal medicine and emergency medicine take a lot more people per year at each hospital. And so there's more spots. And so it's competitive, but it's not as competitive. You have to decide that before you graduate medical school.
But if you're thinking to yourself, okay, I really would like to go into ophthalmology or dermatology, you need to be ready to work really hard and get really good grades. Would you say that?
Yeah, exactly. This path is definitely the bar is always going up and up in terms of you kind of up the ante on your examinations. You work hard in college and you take the MCAT to get into medical school. And the MCAT dictates what level med school you'll get into, so to speak, how competitive you are. And then once you get into medical school, you take the STEP exams, which there's 3 of them. And those STEP exams dictate what kind of residency program you're competitive for. And so each time you move into another level, there's more exams that kind of up and keep upping the pressure a little bit. But and they also dictate what kind of path you're going to go down next.
Is medical school similar to college where you kind of pick a major and then you pick what classes you want to take? Is that how it's laid out?
No, so it's a little bit more like high school where everyone has the same classes and you move, since it's a smaller group, it's usually only about 100 people in each class total, like graduating class. So everyone moves through and takes the same curriculum each year for the 4 years together. So you don't really sign up for classes like you do in college. For the most part, you don't pick electives. The first 2 years of med school are like classroom-based learning, and so everyone's in the same pool together. You all take gross anatomy together. You all take biochemistry things and basic science courses together. And then in your second 2 years, that's when you move into the clinical phase and you rotate in the hospital. And everyone, for the most part, does the same rotation. So everyone in the third year will do a rotation on internal medicine, and everyone will do a rotation on general surgery. But the order in which you do it is a rotation. So it's usually every 4, 6 weeks, or 8 weeks. So people all do the same core rotations clinically, but they do them at different times just because of scheduling issues.
So do you actually have any hands-on while you're in medical school?
So the first 2 years, the only thing you really have that's hands-on in your first 2 years is the cadaver lab for gross anatomy. Some people go and shadow during those years and just kind of their free time just to see what different specialties do and what different parts of medicine are like. And there are some, student interest groups that host sewing workshops and things like that. But you don't do anything hands-on per se with patients, with real patients, until your third and fourth year, when you get out into the clinical phase and you start rotating on real services and being part of the team.
So are you actually working on patients in your third and fourth year of medical school?
Right. So in medical school, you yourself will really never, ever be doing the procedure yourself, since you're only a medical student, but you'll be assisting someone who's either a resident physician in training or the boss, the staff surgeon or staff physician. You'll be assisting them or watching them. That's why after medical school, you do a residency and/or a fellowship, because that in your residency is when you actually get to be doing the surgeries or the procedures in the medical decision making. You actually get to do that part as a resident, and that's after you graduated from medical school. But during medical school, you join the team, and in a sense, sometimes it's in a capacity of you're kind of shadowing and hanging out with the team and just soaking it all in. And sometimes it's in a capacity where you're actually going and interviewing patients and talking to them, figuring out what's going on with them, and then you come back to the resident or to the staff doctor and you tell them the story and kind of come up with a plan. And so it's kind of hands-on learning in that way. But you yourself are never actually independently treating anyone because you're not a doctor yet.
But when you graduate medical school, is that when you get the title of doctor?
Exactly. Okay. And then you do your residency training program, and that's when you actually start taking care of patients somewhat on your own, but with supervision.
So how does it feel when you actually start to work on your first few patients?
Yeah, it's definitely awkward. I mean, in medical school, they have fake patients that they have you kind of practice on. And you practice interviewing and you practice listening to the heart and lungs, doing kind of, harmless procedures on them, like examination maneuvers. And that's always really awkward because it's always awkward at first to be touching a stranger. But once you get used to it and realize that it's part of the job, you stop seeing people in being embarrassed in that sense. And you start seeing them more as like you're there to help them, and you're there for business. And then by the time you're a resident, it's still awkward, it's still uncomfortable. But once you get 1,000 reps of something in, it becomes second nature, and you don't even notice it anymore because it's just part of your job. But yeah, early on it's pretty awkward.
Did you have anybody drop out of med school, or does that not happen?
No, people do drop out. They either have, unfortunately, bad things happen, to their family or their life, and they have to go home, help their family, whatever it may be. But there's also people who always thought they wanted to be a doctor, and then they get to medical school and they just realize it's not for them. I would say of the 100 people that started in my med school class, I think we lost 3. And it wasn't because they failed out or anything, not because of any intellectual reason. It was just they either changed their mind or we had one guy who changed and went to dental school instead. And one girl who decided to do a PhD and become a researcher, which was fine. So people do change. It's not, it's such a hard road to get there. You spend so much money to apply. It's not very common, but it happens.